So joining us now is Dr. Susannah Hills. She is a pediatric airway surgeon and assistant professor at Columbia University College of Physicians and Surgeons. So Dr. Pfizer initially proposed eligibility for everyone over the age of 18 in September, but it was denied due to a lack of information. What more do we know now about the Pfizer booster?
Well, we've had really helpful data, Anne-Marie, from international sources. Qatar and Israel were published in the New England Journal of Medicine last month. And then the CDC had its own data that they shared in September, which showed that vaccines, the immunity that they give us does tend to wane or start to wane about 4 months after your second dose of the Pfizer vaccine, for example, or the Moderna vaccine. So the concern is, of course, as this immunity wanes, are we at risk? Are we vulnerable to another potential surge? And the booster vaccine, the booster doses that we've given, that we've tested, really do show an incredible boost in the protection from the coronavirus after giving that third shot, that booster shot. So it's really an important thing, not only for those who are immunocompromised, which is about 3% of the US population, and those who are older and vulnerable in that way, but for our general population as immunity starts to wane from those initial doses of vaccine.
So, Dr. Hills, given that many adults got the initial vaccinations back in March, back in April, and into the summer, how essential is it that all adults get the boosters now? And it raises that question that I've had over the last couple of weeks, and I've talked to Anne-Marie about this too, the mix and match question, right? So if you were, right now, Moderna is available as a booster. If you received the Pfizer vaccine like I did back in March, I've seen some studies that suggest that getting the Moderna booster, if you've had the Pfizer vaccine, may actually increase your protection as opposed to waiting for the Pfizer vaccine. Or should I wait until the FDA approves Pfizer and go for Pfizer?
Yeah. That's a great question, Vlad. And yes, there is some thought or some data suggesting that mixing and matching may potentially confer additional or slightly better protection, but we really don't know that because the majority of the population has not gotten a booster. So we really don't know. I think the general takeaway is that everybody who gets a third dose will get better protection that should last significantly longer than those first two doses. So the takeaway is, start thinking about whether, first of all, you're at risk, whether there's an immune issue in your family, or whether you yourself are more vulnerable to illness from your medical history or from your job or your workplace, and talk to your doctor about whether now, given the current status of boosters, you're eligible for a booster, and go ahead and get one. And then my hope is certainly that the opportunity for boosters will be open to the general public in the near future, because there is a concern that immunity is going to start to wane. We're entering the holidays, and what we really need to avoid now is a potential surge or increase in cases as we come out of the holidays in January.
The FDA delayed its decision on Moderna's vaccine for children 12 and up because of concerns about a rare heart condition. What can you tell us about this?
Yeah, the concern is, Anne-Marie, for pericarditis or myocarditis, which is an inflammatory condition of the heart. It is, first of all, I just want everyone to know, incredibly rare. So the cases of this inflammatory disease are not being seen with any frequency, and it's about 70 out of a million young people, particularly males who are vaccinated, who are potentially likely or at risk for getting this. So the vast majority of adolescents, males, young people who get vaccinated will be fine. In addition, the cases of myocarditis, pericarditis that we're seeing are mild. Typically, people will recover, they'll do well. Many of them will go back to absolutely a normal state of health having this inflammatory condition. In addition, it's really important to remember that, yes, we may have these cases of pericarditis or myocarditis extremely rarely, but we're preventing significant cases of COVID-19 that are causing hospitalization, that are causing death, that are causing systemic inflammatory conditions that affect the organs. So the negative effects of the virus, the frequency of getting organ failure or inflammation of the organs just from getting COVID-19 is a significantly higher risk than getting myocarditis or pericarditis. So at the moment, yes, we feel that these vaccines are safe. People need to be aware so they can look for the symptoms if they feel like they're having fevers, if they feel unwell after getting the vaccine. But generally speaking, the vaccine is incredibly safe, and the side effect profile is low, with just the typical side effects of pain at the injection site, perhaps a little swelling, perhaps mild fever, or feeling fluish for a few days.
So there's been a lot of focus on kids and their physical and mental well-being during the pandemic. What do you think the vaccinations will do for their overall psychological health?
Well, across the board, from all of the kids that I've spoken with who've gotten vaccinated, Vlad, and it's not a huge number, but there's a handful of kids, and every single one of them that I've spoken to in my own clinic who've been vaccinated, or children of friends, are all saying that they're relieved now to be protected. And I think their parents too are relieved. And the sense of relief is coming from the fact that now they feel protected, that they can socialize with their friends, go back to sleepovers, go back to feeling comfortable in gatherings at times without masks around other people who are vaccinated, other kids who are vaccinated. So I think it's going to be a huge relief for all those kids who are vaccinated. And I think it's a step towards kids feeling less vulnerable, feeling so scared about getting sick or about getting the virus. Now the kids can get vaccinated. Those who are protected will feel safer. And I think that is going to be reflected in their overall sense of wellness, in their mental health, and in their comfort being in groups and being able to socialize. One of the things that's been most difficult about this pandemic is seeing kids being concerned about being social, having anxiety about the illness that they're seeing all around them. So I think it's going to be a huge emotional and psychological benefit for these kids to feel that protection and to feel safe again.
Doctor, before we let you go, I've got to ask you about Aaron Rodgers. There's been a lot of talk about him, obviously, for flouting the NFL protocol when it comes to COVID, and claiming that he was immunized when he was asked if he was vaccinated, and he sort of apologized for anyone who may have been misled when he said he was immunized. The football star says that he's actually allergic to a component in the shot. So U.S. Surgeon General Dr. Vivek Murthy was on CBS Mornings and discussed misinformation today. I want to play some of that sound.
This is exceedingly rare. One of the things I think to draw, though, from this whole example that's been talked about more recently is that who you get your information from really matters.
Yes.
Because somebody has millions of followers, in social media, because they happen to have a well-known name, does not mean that they are a credible, authoritative source when it comes to vaccine information.
So he said, it's incredibly rare. Of course, there are going to be people, parents in particular, that are going to hear, there's a possibility that you could be allergic to a component in this vaccine. What's that about? So now that the vaccine is available for more kids, what can parents do if they're hesitant and they're looking for credible resources?
Yeah. First of all, Emery, they can go right to their doctor. They can go to their healthcare provider that can tell them exactly what's in the vaccine and can tell them what the chances of having an adverse reaction for their child are. And the chances, by the way, are incredibly low. In the studies that we had, the trials prior to approval of the Pfizer vaccine for children in both the adolescent group and in the 5 to 11-year-old group, there were essentially no cases of severe allergic reactions. Now, of course, as we see millions of children getting vaccinated, there will be incredibly rare cases of some significant allergic responses, but it's going to be incredibly rare. This is why we monitor and watch everybody after they get the vaccine to make sure in the initial post-vaccination period, there's not a significant response like anaphylaxis or swelling or something that we really need to be concerned about. But talking to your physician and really getting an understanding of what's in the vaccine and how low these chances of a significant allergic reaction really are, I think will make a lot of parents feel more comfortable.
All right, Dr. Susannah Hills, you always make us feel more comfortable. Thank you very much for sharing your insight and analysis with us and our viewers. We appreciate it.
You bet.